Hey everybody, what's up? So I wanted to start this video as like this isn't me, trying to get sympathy or anything, because honestly, it's just me being realistic here for a moment. Um, so this past month, um, I ended up I still have to see the doctor. There's a whole thing behind that. Went in for a cochlear evaluation test. If you don't know what cochlear implant is, basically they put like a processor behind your ear and you kind of have this like earpiece so you can hear her better. Hearing aids are more of an amplification thing more than anything else. And my thing is, like, this is the part that worries me, and they don't have, like this overall how is it going to affect you thing. So I get this paper. I'm not going to show you any part of it because it'll give information away. Um, One of the things I love is cochlear implantation, loss of residual hearing in the implanted ear. So my left ear is basically my worst ear. And if they were to go in and do the implant and they can't save my hearing, basically that side, I would lose complete hearing. Everything would apparently may start to sound, mechanical. And they said, oh, a lot of people get used to it. It becomes a norm. But I don't want that as a norm because I read so many people saying that is the biggest problem they've had is not being able to enjoy things because they lost that hearing. Um, and they kind of showed me where I was out in the chart, and it's freaky to see how much hearing I've lost and what they expect could happen. I'm just like, I don't want to deal with this. I just don't. Um, Changes in taste. That was actually, she's telling me, person that with the implant department, that, oh yeah, your taste may change, taste and things may change. Like I don't like that. The biggest issue is the implant itself, the processor and everything else. If the processor fails or something else happens, they have to go back in, remove it, replace it. They said, oh yeah, these things can last 10 years or so, but at the same time, if it fails or if it's not for me, I basically stuck with something in my head unless I could go screw it, remove it. um if you have thick skin, they may not be able to put it in a certain area. Then skin over magnet site, there's like a magnet that attaches to the processor, in some places. Then skin over the magnet site could result in skin breakdown. Don't want that. Um, they say initial activation 2 weeks to 1 month after surgery. Basically, like you're dead in the water. I'm going, great. Don't want to have to deal with that stuff. Um, Initial activation is different for every person. In response to speech or sounds, you may only hear beeps, chirp, and static. If you can distinguish speech, it may sound mechanical at first. The goal is initial activation is for sound to be audible and comfortable. Once again, I've had somebody tell me they had a relative who had it done and they heard just fine. This is the internet, so you have to take everything with a grain of salt. There's kind of a 50-50, 60-40 in terms of what dislike to like, how much has helped people out. One of the things about the mechanical part of things is people said, I can't enjoy music anymore. I'm like, oh, that sucks balls. Range of performance for cochlear implants, from aid to lip reading and sound awareness of hearing environmental sounds to understanding speech while in quiet environments. I lip read. That's why, doing these masks, don't help. We cannot predict your long-term speech understanding performance abilities. Typically, speech understanding performance improves over time. Peak performance after 1 to 2 years post-activation. Not, I'm going to say, some of this is just like freaky long-term expectations. A cochlear implant involves lifetime commitment on the part of the patient, programming appointments, traveling to appointments, time off work. Your cochlear implant manufacturer is an important provider of device support. Each patient is responsible for equipment repairs and sound processor upgrades. Yeah, see, depending on the implant, I've heard a lot of people say, like with the technology, once it goes away, it is really hard to get this part, so you're gonna have to get another one or just go without. Use of the telephone, music appreciation, speech understanding, and noise varies from patient to patient. That's, once again, the mechanical side of things. Recommend continued use of hearing aid if applicable in the non-implanted ear. So that doesn't make sense to me because it's just sound amplification. There are dual implants that I've read about, but like the hearing on the left-hand side is way underneath 40 for speech recognition by this point. The right ear is getting close to that part. Special consideration for patients considering sequential bilateral cochlear implants. Research shows that most patients who use two implants are able to attain better speech understanding and provide and better localization compared to cochlear implant contra hearing aid users. Plus hearing aid user, I mean, sorry. Um, so kind of like you use both, which that's like it doesn't make sense to me. That's one of those weird things. And the reason I'm making this video, I'm hoping people watch and give me feedback to their experiences, stuff like that. Um, Bilateral advantages, better speech understanding, better views of listening. Even in patients where benefits is difficult to measure in the lab, they still like continue to use both cochlear implants. It's like, how do you get both unless, like, what is it, like one side, your hearing breaks down on one side, then it breaks down on the other? Not going over that part. Special consideration for patients with single-sided deafness. Single-sided deafness is a condition where an individual has non-functional hearing in one ear and receives no clinical benefit from the amplification of that ear, while the contralateral ear possesses normal and near normal hearing. Which I think that's pretty much close to what I am. The goal for the cochlear implant side to be complementary to the normal hearing ear. Like almost like the levels of speech recognition are shot on the left hand side. Other options, I don't know how to. Osteo integrated hearing device, example, their cochlear Baha, which is kind of like screwed into your skull. Which I don't know. I've seen people with them. I've always wondered, but it's like, do I ask? It's, potential benefits of cochlear implantation, opportunity to hear from otherwise non-hearing ear, improved localization, improved speech understanding, and noise. And it really boils down to, like what they said, how willing are you to work on this? How willing are you to, listen to what's going on? And they said, what was it? Cochlear implantation requires a strong commitment from the patient to wear the sound processor all waking hours. I don't use my hearing aids all waking hours because I've gotten so used to the quiet. It's weird. It's like when I put them in, like appointments or work or whatever, I'm just like, it's weird for me to hear everything. Home listening practice and a professional oral rehabilitation therapy is recommended. Oral is kind of like where they teach you, like a speech therapist, apparently. It's kind of one of those things. See, like I said, I'm just trying to get people's opinions. Sound processor warranty from all manufacturers 5 years. Internal device warranty from all manufacturers 10 years. So basically, the outer and the inner is like, what's the difference? Like they don't cover that. They should be like 3 different brands. They didn't do that the last time, which was 4 years ago. It was like, okay. Based on this specific electrode array from being implanted and the amount of residual hearing in the implanted ear prior to surgery, the physician may choose prescribed neurosteroid to take prior and during initial activation of the implant. Research has shown this medication can aid in preservation of hearing. They don't tell you this because what they're telling you is like, we're going to stick this wire into your cochlear. You can actually look up the surgery. It's freaky. Like they chisel your skull. There's stuff in here they don't tell you. They probably wait until you go, yeah, I'm ready to do this, and they tell you, okay, this is the rest of the stuff that's gonna happen. Meningitis, for example, you have to get meningitis shots. Like you can have fluid leakage. Like if you know someone or yourself has had this, go on, please let me know what you think. Um, if you know of any support groups online that I may, I there's so many stories. Like there's Reddit, there's other groups. I don't know right now. It's just creepy, weird to me because it's like how much of me wants to get this, how much of me doesn't want to do it. Um, the situation with having to reschedule for the doctor, like it would have been close to 2 hours to see the doctor. They were so far behind. I'm just like 2 hours, hour and a half. I'm going criminy. Like I had to ask somebody, hey, how long is it going to take to get this appointment? To see the doctor. And they said, oh, it's going to take another 40 minutes, and the appointment, like criminy. It's like I had to borrow a car to get there because my car's in the shop. Meh, what are you going to do? I said, everybody, talk to you later. Take care. Bye.